The public issue I'm going to discuss is America's fentanyl epidemic. Fentanyl overdoses in the United States. People are dying from overdose at an alarming rate in the United States, with nearly 200 Americans dying every single day from overdose related deaths. The misuse of opioid drugs has contributed greatly to this nationwide epidemic. This is because opioids are often used as medication for pain management, making opioids commonly and easily accessible to the public. Opioids also pose a risk to the general public. This is because opioids have infiltrated illicit street drugs, which may contain fentanyl without the user's knowledge. Both instances pose a detrimental risk for public health as opioids continue to claim the lives of Americans. What is fentanyl? To begin, fentanyl is a synthetic opioid. For the purposes of this presentation, opioid and fentanyl will be used interchangeably. It was first created in Belgium in the 1960s by Paul Janssen. Fentanyl was later approved by the United States FDA in 1972 for use as an intravenous anesthetic. By the 1980s, however, there were already reports of illicit drug abuse and misuse by clinicians, anesthesiologists, and surgeons that prevailed into the early 2000s as well. This cycle of fentanyl abuse and addiction has continued into the 21st century and has spread beyond the field of medicine and into the streets as more and more lives continue to be lost to opioid addiction and overdose. Why is fentanyl so addicting? Like other opioids, fentanyl triggers opioid receptors in nerve cells. These endogenous opioids are naturally occurring in the body and act as a responder to pain. This natural response to pain is precisely what synthetic opioids aim to replicate. For this reason, fentanyl is a successful medication for pain management and is utilized frequently in the medical field. However, this raises implications for patients prescribed opioids as there are heightened risk for addiction. In fact, 50% of patients prescribed opioids for non cancer related pain become addicted. Addiction to opioids increases the threat of the opioid epidemic as addicted patients may be unable to wean off their pain medication or may resort to obtaining opioids from unreliable sources once their prescription ends. Fentanyl is profitable. Fentanyl is commonly mixed into or cut with other illicit street drugs such as cocaine, ecstasy, Xanax, and heroin. This can be extremely dangerous for users who may be unknowingly consuming fentanyl under the guise of another drug. However, cutting other street drugs with fentanyl is profitable due to the fact that it has a high potency in a small quantity. In fact, the DEA's 2016 intelligence brief explains the profitable value of cutting fentanyl with other drugs as 1 kilogram of fentanyl can turn into $5 to $20 million in sales. For this reason, street drugs across the United States have had a massive increase in drugs tainted with fentanyl, which threatens all members of society. Fentanyl affects all ages. It is a common misconception that only the youth are at risk of overdosing. However, fentanyl affects people of all ages. At any point in anyone's life, they may be prescribed an opioid for pain management, which may result in addiction, overdose, and even death. Furthermore, anyone experimenting with street drugs are at risk as these illicit drugs may contain fentanyl unbeknownst to them. This is because fentanyl is tasteless and odorless, which makes it hard to detect amongst other white powdery substances. Overdose can easily occur with just a small amount that is equivalent to a few grains of salt. Drug tests. Another issues arise for the opioid epidemic is, as fentanyl is not commonly included in hospital urine drug tests. This is because synthetic opioids are often omitted from the standard hospital immunoassays. This raises difficulties in treating individuals in active overdose who may have unknowingly consumed fentanyl and, even upon speaking medical treatment, are still unable to detect the cause of their overdose. The lack of drug testing for synthetic opioids is what contributes to the dangerous fentanyl poses because opioid reversal drugs may not be administered in time. Harm reduction strategies. Current harm reduction strategies for preventing fentanyl overdose include drug testing centers. These centers offer recreational drug users the chance to safely test their drugs for dangerous substances like fentanyl and also obtain tools for drug use in a safe manner. While this may seem counterproductive, these strategies reduce overdose from fentanyl by limiting the amount of fentanyl in the streets and providing individuals a safe environment to partake in illicit drugs. Additional interventions could include affordable and accessible distribution of naloxone or Narcan. Narcan acts as an opioid antagonist to stop the effects of an overdose, and it is available as a nasal spray and injectable shot. This medication can save numerous lives through proper education on how to administer it in the event of an overdose, and also through widespread distribution of Narcan, especially in urban cities. To conclude, it is evident that opioid abuse remains rampant in America and will continue to claim the lives of thousands of Americans annually. While there are negative stigmas and misconstrued notions about drug users that often dismiss drug induced death to be a personal problem rather than a social one, every single American is at risk of potentially developing a debilitating addiction given they are in a position where they may be prescribed opioids for pain management. For this reason, drug users and addicts should be viewed in a compassionate light so that they may receive help and support that is essential for ending America's opioid epidemic.